Hello and welcome to Nurse Table Talk. I'm Nurse Julie, and today I'm wishing you all a happy new year. I know it's been a while since I've been recording some videos. I had personal surgery to get through, and because of that, I wanted to share my items that I needed, and they come in really handy after a surgery or a procedure. So let's get started. Okay, so the first item that I wanted to talk about is an incentive spirometer. And I have a couple of models here. These are usually given in the hospital. For an outpatient procedure, they may not give them to you, but they can be purchased on Amazon or a local medical supply company. But these are to help exercise and expand your lungs after having anesthesia, or if you have congestion. Sometimes you can keep them throughout the year. Please, if they give you one in post-op after surgery, keep it. Don't throw it out. I mean, this could come in handy for you or a loved one if somebody is trying to get over bronchitis, maybe had pneumonia or a history of pneumonia, but it does help expand and exercise the lungs. There are videos out there on how to use this, but I'll give you a basic overview. The doctors would explain to you how to use it. Your nurse would explain, and they would tell you how many times to use it, how often to use it throughout the day, and give you some basics instructions on how to do it. But an overview. So this piece expands and it comes apart here so you can wash it and keep it clean. But you would suck in like a straw. And this little indicator, the point is to keep it between the arrows. Here's a little smiley face, so you could keep it there. So you're sucking in with like a straw, and you're balancing this indicator here. Meanwhile, this piston is rising and helping you see how well you're doing. And it takes time. You may start low and then each day work up a little bit more. But again, it helps clear out the lungs. You may have some coughing. But again, you don't want to do it, then do it, and then do it again and hyperventilate. You just want to, do it. I don't know, sometimes they recommend 10 times in a row, but take your time. You have to catch your breath in between and follow the instructions of what your provider tells you. So let's see how well my lungs are working this morning. I have to work on it. But anyway, this is what is called an incentive spirometer. So keep this in mind. Okay, my next item that I had to have were compression hose. So my surgery was total hip replacement, and they gave me compression hose in the hospital, but they were, they work well, but for some reason, the band at the top of the stocking, they were thigh high, kept rolling down. So then I'm trying to keep it up and keep it comfortable and have it not bunch behind the knee or at the ankles. So I went and purchased a stocking or some compression hose. And the brand that I picked happened to be called Duomed, and it was a really nice product. So there's many items out there, many companies out there selling compression hose, but your doctor will usually provide a prescription on how much pressure he wants those hose to have. So I followed the instructions, what my provider wanted, and I ended up getting a stocking. Again, these were thigh highs and they stretch. It was a really nice material, so it didn't bunch behind the knees. It didn't slip down to my ankles, anything like that. But the band laid against my skin. It didn't roll. It didn't bunch up. It was just really nice and comfortable. They were easier to get on, which is my next product that I want to show you. They were easy to get on because I know I have to reach over and grab these. I had some gloves to use. Now, again, these are just another brand of gloves, but there are many brands out there, and I happen to choose this one. But the reason is I looked for the texture on the glove. It's a latex glove, or you can get some lighter industrial gloves that have texture, because what happens is when you're putting on the stocking, and you may be getting help doing that, um, the texture from the gloves grabs onto the material and helps it pull it forward much easier. It saves a lot of frustration. So just keep that in mind. The gloves are the key to getting compression hose on. I don't care what kind you have. Okay, moving on. I graduated from my thigh high compression hose and I went to a medical knee high stocking. And this stocking happened to be, I guess I want to say toeless, and it was an open toe. And again, same compression that my provider wanted me to have. And, I used the gloves to get them on. These were a tighter compression. They were the same compression as what my thigh high stockings were, but they had a nice band on them. And the secret is the bands. And, also when you wash these, you want to not put them in the dryer. They're already hard enough to get on. You don't need them shrinking and then really battling them and then giving up totally. But compression hose really help keep your swelling down, improving your circulation and just giving your legs a much more comfortable feeling, less fatigue, and more energy. Just saying. Okay, so finally, after that medical stocking, I went to an over-the-counter stocking, and they had some cute designs in that. This is a company called Sockwell, and I went and got these at a medical supply store. I'm sure there's other places that sell them as well, but these had a lighter compression and a little bit easier to get on, but I still use the stockings. And just because it makes my legs feel better, it's obviously winter, and it provides warmth as well, but I still use the gloves to help get them on, even though they're a lighter compression. So those were two of my needed items that I had because of the type of surgery I had. Also, using a walker, a cane, a toilet riser, or a bedside commode. Those three things are wonderful to have for surgery as well. In addition to the type of gloves that I had to help me get my stockings on, I also had nitrile gloves in the house. Sometimes your caregiver may want to have a pair of these for any reason. Just to have these in the house is a really good idea. We also have, I call this a little grabber. And if you drop something on the floor, it is a really nice product. It has very easy to use. It has, you could pick up a cotton ball or something if you're putting your makeup on, or, you drop something on the floor. It's just there to help pick items up if you're not able to do it initially after surgery. A lot of times the doctors may order physical therapy to assist as well. They also have stocking assist, and we can put a picture up of what they are. I did not personally have one. I asked my physical therapist, hey, what do you think of these? And he said they're fine to use initially, but you want to work towards being able to be independent as much as you can to get your stockings on. But again, if you have surgery on your hip or your leg, sometimes it's a little hard to get those on and get your leg up to get your stockings on by yourself. So these items come in handy. Finally, I wanted to show you one more thing, and that is a bedside sheet. It's actually, sometimes they call them a boosting sheet, or there's just all kinds of names for them. But this particular one I really like. This is about 5 feet by 4 feet. It's quite big. And it has handles on it to help somebody boost you up or move you over in the bed so you save your back and you don't get hurt while you're helping your loved one after surgery. But what this is, this one I particularly like because it is 100% cotton on one side, and it has a little bit more slippery material on the other. Because it was cotton, I felt comfortable laying on top of it. Some people may put it under their sheet, but you still have to be able to access the handles. So it's up to you how you use it. Also, when you wash these, you don't want to put them in the dryer. You just hang them dry. But these you were able to wash. I got this product off of Amazon. Again, there's probably a lot of medical supply houses that carry these items, but these are products that you may want to have in your house and just keep them, keep them around because you never know if you're going to help somebody boost up in bed, pull them over so they don't fall off the edge. And you can get up there and manage it because of the handles and get good leverage without hurting yourself. So these were my items that got me through my surgery. Of course, I had caregiver help and it was great. And a medication log is also a good idea to have. Things come up, your caregiver's trying to prepare the meals, help you to the bathroom, help get you positioned so you're comfortable. There's just multitude of things that people do to help their loved ones after a procedure or a surgery. So thank you for watching, and we'll see you next time. If you like this video, please hit the like button. Please subscribe. It helps my channel grow, and we'll see you next time. Thank you so much. Bye now.
Nurse Table Talk. Save time, save money, be informed. Thanks for watching.